cystic fibrosis is a debilitating and life-threatening disease that must have close monitoring. UMC is home to Nevada's only fully accredited cystic fibrosis clinic, with an entire team of doctors, nurses, research coordinators, respiratory therapists, nutritionists, and social workers to help keep both adult and pediatric patients as healthy as can be for as long as possible. 8-year-old Simon McCune is fast on the soccer field. He looks like the picture of health. In the water, Simon is a championship swimmer, winning race after race. When you look at his bronze young body, you would never know he has a debilitating disease, cystic fibrosis. Simon was born with a bowel obstruction and had his first surgery when he was less than 24 hours old.
The CF doctors came up to the NICU and thought that he needed to be tested, and sure enough, that's what it was. So he, at 7 weeks, had another surgery to reconnect his bowel.
Since then, it's taken a lot of Simon's family's dedication, expensive medications, and daily breathing treatments to keep Simon healthy.
I think it helps my lungs to breathe a lot better.
But it's taken a long time to get to normalcy. He requires 25 pills a day. Every time he eats, he has to remember to take medication. He does chest physical therapy twice a day. It takes between 40 and 50 minutes, depending on how quickly the medication nebulizes.
Simon is just one of hundreds of patients who depend on UMC's Cystic Fibrosis Clinic to keep them healthy. It's a disease that must have constant monitoring, treatments, and medication.
A defect that causes abnormal movement of electrolytes in the body, particularly salt. So therefore, patients tend to get clogged mucous membranes, clogged different channels, like their airways in their lungs clog up, their pancreatic duct, all the different ducts. They get thickened secretions in their intestines.
For most patients, that means about $12,000 worth of medications every year and upwards of 11 hours a day doing different therapies. It takes an overwhelming commitment by patients and their families to keep this disease at bay.
It's daily therapy every single day for the rest of their life, and they can't really get away from it. It's always there. And
Dr. Craig Nakamura is the director of UMC's Cystic Fibrosis Clinic and says hope is on the horizon.
About 30 years ago, the median lifespan was in the teenage years, and now it's in the late 30s, somewhere between 36 to 38 years of age. And so that's the median lifespan. We have a number of patients who are actually older than 50 years of age at this time. And so patients are living longer and doing better.
For Simon, that means when he's not doing his breathing treatments or coming in for a clinic visit or taking his medication, he can concentrate on being a growing boy, taking leaps of faith with hope for the future. For more information on UMC's Cystic Fibrosis Clinic, please call 383-2631.